Good morning. This is Crystal High reporting for Politic 365, here today with Representative Beverly Earle. How are you today?
Doing fine, thank you. What about you?
I'm doing well. Thank you so much for taking some time out to talk with us. So there's so much going on. Elections are, I guess, 30 days out roughly.
Yes.
Right around the corner. And there are a couple big issues. Number one on our list, health care. What's going on? What's the plan? What do people need to know?
Well, most folk don't truly understand all the components of the new health reform. I mean, it's going to be huge, and really legislators don't understand because because I chair the budget for Health and Human Services, I'm quite involved with all of that that's going on. And we're going to have to pass a lot of legislation next year related to this health reform, and most legislators don't realize it, because I didn't realize it for a while until I started attending all of these meetings. So, and some of it has already gone into effect, where parents can keep their kids on their insurance policy until they're 26, and there's some other components where you can't be turned down, for existing condition. So I mean, there's a lot of it that's already gone into effect, and I don't know how anybody can say that this is not a good thing. It's just good for everybody to have some kind of coverage. Plus the fact, on the other end, it saves money, because if people don't have access to health care, then they're going to show up in the emergency room, and that's going to cost all of us that are paying. So, I mean, it's a huge issue, and it's not going away, because you've got folk out here talking about repealing it, and I don't know. I think that's just a part of the no strategy, because it certainly doesn't make sense to me.
Right. Well, talking about kind of the potential repeal of the health care reform, that's like a big possibility if, come November 2nd, we lose a lot of Democratic seats, not only, at the federal level, at the local level as well, state level. How important is it that people really get out there to vote right now in this election?
Folk got out and voted in the 2008 election, a lot of young people, a lot due to Obama, and their excitement there. But you know what? This election is just as important, because, first of all, we're going to be redrawing the districts. The state legislatures draw the districts for us and for Congress. So, it's key that Democrats are in leadership, because if we are not, one thing that's going to happen in North Carolina, if we go Republican, we will never, ever have Democratic leadership again, because what you need to realize is that North Carolina is the only state in the South that still has Democratic leadership. So if we go, we are gone. And also, if Democrats are not in the leadership, we're going to lose some minority representation. So, because we've seen their argument in previous redistricting, but aside from that, the Republicans are big on cutting taxes and less government. And so I just had a conversation last night. I was on a meet and greet for candidates. And my thing is, you cannot cut taxes without cutting services. So when somebody tells you, we're going to put more money in your pocket, we're going to cut taxes, then next question is, what services are you going to cut? And in North Carolina, education and Health and Human Services are the two largest budgets. We're looking at a $3 billion deficit when we go back. So it's not going to be a pretty picture, and if folk think it's bad now, they have not seen bad if Republicans take leadership in the state or on the federal level. It's going to be bad.
Well, thank you so much for taking time out of your schedule today.